Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot, now to return a lot to the word. The topic of today is mouth ulcer. Introduction of the mouth ulcer is a mouth ulcer is also called aphtha. Other name is oral ulcer or mucosal ulcer or with aphthous stomatitis. These are all the names for the mouth ulcer. It is an ulcer that occurs on the mucous membrane of an oral cavity or at the base of the gums or on labial mucosa lining of the lower lip. Ulcer by definition is just discontinuity in the continuity of the any lining mucous membrane or the any other lining is called ulcer. Mouth ulcers are very common. 20% of the people will develop at some point of their life the mouth ulcers. It occurs with many diseases. A non-healing mouth ulcer is a sign of oral cancer which is need attention. These occur as single or multiple ulcers, the crop of ulcers. Ulcer has inflammation or the secondary infection over them. So here one can see this is the canker sore and it is seen usually on these sides of the lower lips. Then stomatitis or the mouth ulcer that can be seen on the tongue and the soft palate and other part of the mucosa. After stomatitis, mouth ulcers are here present on the gums near the teeth. So these are all the mouth ulcer seen at the various sides inside the mouth. Now, an ulcer from Latin ulcus, ulcer, sore, is a break in the skin of the mucous membrane. As I have already told you, the discontinuity in the continuity of the lining is called ulcer. With loss of the surface tissue, with necrosis of the epithelial tissue, a mucosal ulcer is an ulcer which specifically occurs on a mucous membrane, so its name is mucosal ulcer. An ulcer is a tissue defect gone to the epithelial or connective tissue border. It is seen at the epithelial connective tissue border. Its base is at the submucosa or the muscles or the periosteum in case of the bone. An ulcer is a deeper breach of the epithelium comparing to an erosion or excoriation. It involves damage to the both epithelium and the lamina propria. So here one can see the ulcers on the gums and ulcer inside the mouth, the lip margin inside the lip. So these are the sites where one can see them. Now, erosion and excoriation. Erosion by definition is a superficial breach of the epithelium with little damage to the lamina propria, but in ulcer, lamina propria is also involved. Here in erosion, superficial epithelium cells of the epidermis or the mucosa are lost, so mucosal erosion reach depth of the basement membrane, erosion heal without scar formation. The other is excoriation. There is breach of the epithelium deeper than an erosion but shallower than an ulcer, which involves the lamina propria. This type of the lesion excoriation is tangential to the retipex and shows punctiform or small pinhead spots, bleeding caused by the exposed capillary loops. I have already shown you in the previous slide. So here one can see the fissure and the erosion, the superficial layers, and the ulcer, which involves the deeper layers, and also the lamina propria. Here one can see the epidermis, and here it is the dermis, that is the dermal papilla are projecting inside the epidermis. So here one can see the erosion, and here there is excoriation, and the secondary lesion which do occur as the erosion, a partial loss of the epidermis. It heals without scarring, and excoriation, already I have told you, it is a localized damage to the skin due to the scratching, as one can appreciate here, and erosion is the loss of the layer of the epidermis. Now, clinical feature of the mouth ulcer, these cause pain and discomfort, make the eating, drinking, and talking uncomfortable and painful, alter the person's choice of food while healing occurs, e.g., avoiding the acidic, sugary, salty, or spicy foods and the beverages as part of the. So here one can see the pathophysiology of the abscess ulcers. Its cause is not well understood. Theory is that cell-mediated immunity leads to the increase of T cells, especially Th1 and chemokines, interferon gamma, tumor necrosis factor, and the macrophages. All these lead to the ulcer formation. It occurs in the oral mucosa, so these are abscess ulcer. Now, causes of the mouth ulcer, there are three most common causes. One is traumatic ulceration or the local trauma, like rubbing from a sharp edge on a broken filling, or the braces, or biting one's lip once one have got the local anesthesia and the sensation is lost, and that is the sharp teeth also, that is rubbing the area. The other is, second is aphthous stomatitis. It is having the canker sores, recurrent formation of oral ulcer, and the reason is not well known. Number three are the food sensitivities to the acidic food like strawberries, citrus, and pineapple, and chocolate and coffee. These are also responsible as the cause of mouth ulcer. Now, the mouth ulcer causes, as one can see here, sensitive to the acidic food such as the lime, pineapple, strawberry, then viral or fungal infection. These also cause as part of their disease the mouth ulcer. Then lack of the vitamins, especially the vitamin B12, folate, and iron. These are just the covering of the skin or the covering of the mucous membrane, and just make strong the mucous membrane so that it is not going to damage easily as can be. Then mouth wound caused by the toothbrushing and the accidental biting of the lip when one have got the local anesthesia while doing to have some dental work. Then dental braces, these are also causing the mouth ulcer, as one can see here and here, because of the rubbing with the teeth, sharp edge, and other problems in the teeth. The only way to do the great work is to love what you do. It is just your extreme love to that thing which is just making you successful. For that, you should have the passion of that thing, and then you can get that. And it is saying of the Steve Jobs, one of the world's richest man and very successful man of Apple. Now, Coming to the traumatic ulceration, most mouth ulcers are due to the local trauma, as because of the mouth is very thin and easily damaged by any damage to that mucosa. This traumatic ulceration is subdivided into following types, five types. Number one is mechanical, number two is thermal, heat or cold, number three is chemical, number four is electrical means, and number five is by irradiation. So I am just going to have it one by one. Number one is mechanical, mostly rubbing on the sharp edge of the teeth, fillings, crowns, false teeth, dentures, or the braces are responsible. Accidental biting following the local anesthetic used during dental treatment. I have already told you. Some absent minded people cause the damage inside their mouth deliberately, causing the self harm like biting the cheek, tongue, or lip, or rubbing a fingernail, pen, or toothpick inside the mouth. Tearing and the ulceration of the upper labial frenum is a sign of child abuse, non accidental injury. And here one can see the ulcer by the sharp teeth and the ulcer by the sharp teeth also here. Okay. Then ulcer by the dentures and the ulcer by the self-inflicting by anything sharp putting in your mouth. Then continuing the mechanical, eating hard foods like potato chips can damage the lining of the mouth. Iatrogenic ulceration during dental treatment by the dental surgeon is called iatrogenic ulceration. Incidental abrasion to soft tissue of the mouth are common. Some dentists apply a protective layer of the petroleum jelly to lips to minimize this mechanical ulceration. Lingual frenum is vulnerable to ulceration during oral sexual activity. Cunnilingus tongue. Rarely infants can ulcerate tongue or the lower lip with teeth, termed Riga fatty disease. So here one can see the potato chips, the dental using their drill machine that, then cunnilingus tongue, the frenulum is injured by having the oral sex. Then this is the Riga fatty disease in which under the tongue there could be the ulceration, and that is a part of the disease. Number second is thermal burn. These result from the placing hot food or the beverages in mouth, seen in those who eat or drink before a local anesthetic has worn off by any dental work that has been done in your mouth. The normal painful sensation is absent and a burn occur. Microwave oven produce food cold externally and very hot internally. So intraoral thermal burn have been seen by using the food which have been made hot in the microwave oven. These ulcers are on the palate or the posterior buccal mucosa as zones of erythema and ulceration with necrotic epithelium periphery. So here one can see the thermal burn of the mouth or the tongue, and one can see the redness also here. So these are all because of that something hot or cold have been put in these area to cause the burn. Now the third is chemical injury, as the name is. Caustic chemicals cause ulceration of the oral mucosa if strong enough in concentration and contact for the sufficient time in the mouth can cause the chemical injury. Holding of the medication in mouth instead of the swallowing it, mostly in case of the children, cause this problem. Aspirin tablet holding next to a painful tooth to relieve toothache cause epithelial necrosis, and chewable aspirin tablet should be swallowed. Other caustic medication include eugenol and chlorpromazine, and here one can see the aspirin burn because of putting the aspirin there, and then chemical burn, putting some chemical on the tongue, and here also one can see the eugenol and the chemicals which have been uh, placed inside the cheek. So that is the causing burn of chemical nature. Now, chemical injury continuing, hydrogen peroxide 1 to 3% to treat gum disease cause epithelial necrosis, silver nitrate for pain relief from the aphthous ulceration acts also as a chemical cauterant, destroys the nerve ending and the cause mucosal damage. Phenol used during dental treatment, cavity sterilizing agent, and cauterizing material can cause the chemical injury. It is present in some agents to treat aphthous ulceration as 0.5% cause mucosal necrosis. Other material used in the endodontics contain caustic, so use of the rubber dam is necessary to protect from this caustic injury. So here one can see the hydrogen peroxide which is being used causing the ulcer, and the phenol and the silver nitrate. These are all notorious for causing the ulceration in mouth. Now, the electric burn, the fourth type of the injuries, these are mostly affecting the oral commissure, the corner of the mouth. The lesions initially are painless, charred, and yellow with the little bleeding. Swelling occurs on the fourth day. Area becomes necrotic and epithelium sloughs off. Usually it is caused by chewing on live electrical wiring seen in the young children. Saliva acts as a conducting medium and electrical flow causes extreme heat and tissue destruction. So here one can see the recent electrical burn. The wire have been put here, and here oral commissure burns, emergency also because of the electrical burn by having the live wire here in the mouth that is causing this necrosis and burn. Number 5 is the irradiation. Radiotherapy to the mouth cause radiation-induced stomatitis. There is mucosal erosion and ulceration. If salivary glands are irradiated, there is xerostomia, the dry mouth, as no saliva is being produced by the glands. It makes the oral mucosa vulnerable to frictional damage and mucosal atrophy, thinning, and the breach of the epithelium is seen. And the main reason is xerostomia, the dry mouth, because of lack of saliva by the salivary gland. So here one can see the burn because of the radiation, and also here in the mouth, the palate and the other part that is also receiving the radiation and having the ulcer because of the radiation. Now, radiation to the bone of the jaws damage osteocytes and impair the blood supply, so the tissues become hypovascular, hypocellular, and hypoxic. It is called now osteoradionecrosis, seen in the mandible and causes chronic pain and the surface ulceration. So to avoid osteoradionecrosis, all teeth are removed before start of the radiotherapy, so that to save the structure from the damage by the radiation.